So let's continue our day of the Future Perfect with our session on the future of health. As we have been hearing from some of M13's portfolio company founders earlier in the day, I'm again particularly pleased you will be able to hear from three more of our founders. Eric Kanariwala, founder and CEO of Capsule, a company focused on same-day prescription delivery to the safety of your home, and Francois Kress, CEO of Feelmore, an innovative health and wellness neurotechnology company, wearable technology, and Ara Katz, co-founder and CEO of Seed Health, which focuses on microbiome science. Latif will join us again, as I mentioned before, one of our investing partners at M13, and who will moderate this session. So again, please enter your questions in the chat. Latif will field as many as we can. And hi, Francois, how are you?
Hey, how are you, Sarah?
Good to see you. Hi, Ara, how are you?
Good, how are you?
Pretty well. We're just waiting for Latif and Eric. It's funny, when I went to Disneyland for the first time with my family when I was younger, we got stuck on the Carousel of Progress between, I think, 1900 and 1920. And so I promise this is not happening now. Luckily, we're in the 21st century. Hey, Latif, I'll hand it over to you.
Hi, thank you. Great to see everybody once more. So I just gave you a spiel on the future of health, but I think it's much more interesting probably to bring on three of our portfolio CEOs who are truly driving that change. So it gives me great pleasure to be here with them. There's probably no other group of CEOs in our portfolio who have such an immense opportunity ahead of them and can drive such impact in people's lives given the state that we find ourselves in today. And so again, I can't wait to turn it over to them. Eric and Ara both have products and services that are in the market and making positive change in people's lives. And I don't know, Francois, how much I'm allowed to say, so I won't say too much, but Francois is very close to launching a business that's in stealth right now. That's a platform, as Sarah mentioned, around mental health that's steeped in neuroscience. So very excited to have you all here. Probably I'll start with Eric. No one has been impacted as much from a business standpoint, I would say, probably as you have. Maybe that's not true, but certainly in our portfolio. Tell us, what is it like running a digital pharmacy business in New York City in March of 2020?
Thanks for having me, Latif. It's been a really interesting, I would call it, 4 months, kind of since the height of COVID in mid-March. And what we saw really like coming into the middle of March was a really big surge in demand from our existing customer base, kind of part and parcel of what I think you saw with a lot of retailers, this sort of like, all of the toilet paper in America, run rating to get sold in 3 days. And what we saw very quickly after that was a really big surge in people for the first time ever, trying out new digital health solutions, and digital pharmacy being one of those things that people were trying out. And so the team, there were weeks in mid-March where the business was growing, 50% week on week. And the team did like a really tremendous job of stepping up to be able to meet that demand to do that. And so I think that it's been rewarding to be able to be a part of the solution. We've partnered up with the local government in the city of New York. We're working on well checks for seniors. It's one of the one or two things that has really come up as a priority for folks has been around consistent, safe access to medications, and so we've been able to partner with doctors who, as you noted, have dramatically overnight have had to shift their business models to virtual, and the pharmacy is a big part of that. Hospitals who had a real influx of people that had COVID, and then really as they were getting discharged, need to be quarantined, didn't have access to pharmacy because you've been discharged and now you're either in a hotel or you're at home, and you really can't be leaving. And so we partnered up with hospitals in New York to support that. And then we're seeing, governments be more involved at a broader base given COVID is such a public health crisis. And so in New
Eric,
York,
can I ask you on the, so I mentioned the regulatory side just now when I was giving a bit of the overview, but how have you seen the regulators adjust based on this huge need in the market, both in New York, and then I know you've gotten a positive reception in other cities, and so could you talk a little bit about that piece of it?
Yeah, absolutely. So, I mean, we've seen sort of maybe a handful of things that are relevant on the regulatory side. One, as you noted, on the telemedicine side, we saw, very quickly CMS put in place the ability to actually bill for telehealth visits, both audio and video visits. We've seen sort of loosening of restrictions around, most of the healthcare system, maybe not unsurprisingly, is regulated both at a state by state level and at a federal level. And it creates a lot of sort of lack of mobility of labor. And so we saw a lot of waiving of regulations around licensure requirements, so that nurses and doctors that, live in Utah can come and support the community in New York. And then on the pharmacy side, one of the things that we're excited about that we've seen is, pharmacists have an essential role to play in sort of the healthcare landscape. And that's always been one of the theses at Capsule, is the pharmacist is one of the most trusted healthcare professionals. And so the ability for pharmacists to be able to prescribe COVID tests and a bunch of other things has been, pretty real.
Great. All right, I would love to hand it over to you as well to perhaps touch on what you're seeing in your world post COVID or during COVID, I suppose, and how is your business? How has it changed in any way the way you think about your business? I think you're on mute.
Sorry about that. I'm in a flight path, so I was trying to spare everybody the Santa Monica Airport planes. In a lot of ways, on the therapeutic side of our work, we don't have any drugs in market yet, so we haven't had kind of some of the regulator issues or kind of scarcity issues that I know a lot of certainly drug companies have had. What we did have on the therapeutic side of our business is that CROs, because of like the rush in biotech and life science to do so much COVID related research, CROs and some of the academic partnerships that we do clinical research with definitely got inundated. So I'd say some of our clinical work has definitely pushed back a little bit. We are going to announce a project soon, though. We initiated our own project for COVID that with Cornell that we'll announce soon, which will be studying the nasal microbiome and the correlation with disease severity for COVID. So whether or not the composition of microbes in the nose or the nasal airway correlates at all with kind of nasal severity. And as we know, like people lose and they have experience in nausea, which is loss of smell. So we think that there may be some really interesting correlations there. So for us, it certainly incepted some research. It pushed some of our research back. And then on the consumer side of what we do, which is kind of what we're more known for out in the world, for some of our innovations in probiotics, we have a single channel kind of D2C subscription business on our consumer health side. And, it actually, COVID, not dissimilar to what we just heard about, Capsule, absolutely has been the gold rush to our category and kind of related categories from a consumer perspective. We made a decision very, very early on. I think there was in fact, the FTC just sent 50 letters out to companies, I think, but including fines, I believe, for the companies that have been opportunistically marketing. So actually we turned our ads off in early March and decided that the conflation with like immune boosting and some of the sensationalism and hyperbole around the idea that you could, increase someone's immune or boost someone's immune system, and therefore there would be some protective effect against getting COVID, was something that we just wanted to steer about as far clear of as we possibly could. So while people are boycotting Facebook right now, we've actually had our paid ads off for quite a while. and instead kind of turn to some like really interesting, I think, marketing initiatives and double down on education, and launched like a big science course, 5-week science course on Instagram, and got a lot of attention, I think, for giving people an alternative to once they've exhausted their Netflix queue. So actually turned more to marketing and education, and decided to, despite still growing, and I think that's because people are looking for this, decided to not participate in the opportunism of unregulated categories that has happened during COVID.
Well, I want to stick with you for a second, Ara. I mean, you've got this daily symbiotic product, which is very well received by consumers. You have a deep passion for bacteria that's driven by your own personal experiences as a mother. Where do you see exciting new modalities developing? What are you working on? You mentioned some of the therapeutics. I don't know what you can share, but we're very interested in the intersection of all of that and the consumer side. So
sure. I mean, despite a virus or a microbe kind of destroying our world right now, or wreaking a lot of havoc, certainly there are also lots of good microbes and ones that can both be harnessed for the potential themselves to impact human health and actually environmental health also, as well as like specific metabolites and compounds that they produce that can also be used for specific applications. And then also, of course, the synthetic engineering of microbes we're also going to see. So where we look at microbes is really on big unmet medical needs. So we focus on the therapeutic side. So for example, Luca Biologics, which was the first biotech company that we've spun out in partnership with Dr. Jacques Ravel, is probably like leading vaginal microbiome scientists in the world. We're looking at, and also in a increasing antibiotic resistance world, it's going to be incredibly important to look particularly at areas where antibiotics may no longer be effective in the future. So for us under Luca Biologics, as an example, big unmet medical needs like urinary tract infection, bacterial vaginosis, preterm birth. And so that's an area where live biotherapeutics, meaning the administration of a microbe or like a consortia of microbes, can be an impactful kind of frontline treatment. So that's kind of on the therapeutic side. We're also looking at some other areas that are big unmet, medical needs and areas where microbes will kind of modulate the immune system, which we're excited about. And on the consumer side, we look at all kinds of future probiotics. So looking at different ecosystems of the body, the skin, the mouth, so like oral care, thinking about the ecosystem of the skin, and obviously like more opportunities for how microbes even ingesting probiotic supplements will impact things like asthmatic airway allergies, for example. So really looking beyond kind of digestive GI health, where I think people know probiotics today, and looking at kind of future applications of microbes.
Great. That's very exciting. Thank you. Francois, I want to bring you into the mix here, and I know you're spending a lot of time on mental health. So on this topic of new modalities, I'm just curious if you can talk to us about where you see interesting developments, perhaps the evolution of where meditation and mindfulness is going, and how that might converge with what you're working on. I think it would be very interesting for everyone.
Yeah, absolutely. Thank you, Latif. Maybe I can tell you a few words what we are doing anyways, because I don't know.
That'd be great, yeah.
Then in the past 4 years, we have worked in developing, based on neuroscience, a technology which allows you to reduce stress and improve sleep just by using a wearable device, which is delivering gentle vibration behind your ears. Then it's very non-invasive, it's extremely safe, it's 20 minutes a day, and we have performed numerous clinical and studies and clinical trials on the topic, showing significant improvement in these areas, all the way to clinical anxiety. Then that's what we are putting on the market this fall on the wellness side. And I think the first thing I'm seeing is really in the field, the lines are blurring between wellness and health care, if you will. I mean, it's more like, especially in mental health, it's a continuum between, being slightly stressed to heavily anxious. It's a spectrum, and there is just a threshold after which you become clinical and you have to move to a psychiatrist, where before that you were maybe just handling it with meditation and mindfulness. And I think it's much more of a gray area, especially neuroscience is not very sophisticated when it comes to measurements and to diagnosis, still based on an individual making a judgment, which could differ substantially from one doctor to another. Then we believe that with all the trackers coming to market and a much better awareness and education, this whole world of wellness and healthcare could merge at some point. And some solutions like meditation and mindfulness, which are one is part of the other, or they are at least overlapping, which we know through clinical trials, by the way, are very effective at curing some ailments, are not much used by traditional medicine when they could be. And then depending on where you are on that spectrum of symptoms and on the diagnosis, you could end up popping pills when you could take care of your symptoms otherwise. And I think that's really the evolution within the next 10 years will be very much in a much more subtle approach of the problems and offering a much broader range of solutions, and not being in such a dichotomy, you're either on one side or the other. Then yeah, I mean, meditation works when it's well done. And that's where there's a bit of a, I think, obviously with all the great apps which have come out and which are extremely successful, which are turning more, by the way, into sleep storytelling apps today for good reason, because meditating or exercising mindfulness are extremely difficult. We know that the churn for these apps is quite high. It's difficult to stick to it. It's a discipline. And only a few happy few really benefit from the actual outcome of it. And I think that's where I believe, because we are kind of closing this gap, what we are doing is effortless meditation. We put your brain in the same state that it would be if you were into a meditation or mindfulness session, a successful one. If you are getting into the zone, then I believe that there is a lot of technology which will be helpful at supporting people in their attempt to use those age-old, practices, which are quite difficult again to read. I know I can't meditate myself. I don't have the patience. I never take the time. I've tried every single app under the sun. Doesn't work for me. Well, there are other solutions.
Francois, we definitely have one very positive customer, which is Christine, our partner, who just put in the chat for the panel that she's been sleeping for 7 hours a night for the first time since 2014, thanks to your device. So hopefully others will feel similarly. But I think it's what gets me really excited too is that it's the ease of use and the fact that it's driving results, and compliance is just so easy. And I think those are really important for consumers going forward. I want to stick with you though, because there is one thing I'd love to talk about with everybody, but we'll start with you, Francois, which is just access. And at M13, we talk about how do we build businesses that are not just for the 1%, but for the 99%. And your product is great. It will not be the cheapest product in the market. So how do we think about how do you think about access, and how do you think about making sure that everything that you're doing can get to a broader audience over time?
No, that's a great question, which we are asking ourselves every day. And by the way, it may not be the cheapest product on the market, but it's going to be the only one in its category. And it's actually the cheapest one. But
that's true.
It's true, right? Then this being said, yeah, we purposely price this device into this white space between all the Kickstarter gadgets you can see out there, which are in the $200, $300 zone, and usually discount from the get-go for early adopters, and kind of like destroy any chance for them to become brands. I mean, I come obviously from a world of very high brand discipline. And I think you have one chance to establish a certain positioning, a certain desirability, which again may exclude maybe not the 99%, but the 90% from the get-go, because we are not talking luxury pricing here anyways, more aspirational. And then over time, we can decline our technology into much simpler devices. We are going to learn a lot and come down in price with new devices. It could be, a whole slew of devices within our portfolio, which could satisfy different segments of the population. Then also even our first device will be covered by FSA, pre-tax money for wellness healthcare devices. There are ways to finance it. When you see what people are spending on an iPhone today, I mean, it's almost 4 digits, if no more. I'm not sure it's relaxing them so much. And it serves many other purposes also. But I think to your point, yes, it's a preoccupation of ours. But I think, first of all, we need to give it a chance for the 100%, we need first to reach a small group of people who really believe in it and promote it. And if these people have to be part of the 1%, that's great because they're usually more visible as well.
Thank you. Eric, I want to ask you, and then I want to ask Ara before we close up here, just on this idea of access. And the pharmacy business is regulated. The price people pay for drugs is regulated. There's not a whole lot of disparity in that, at least within the U.S. market. But if I think about Capsule, it's a very much in New York. It feels like a very high-end digital brand in many ways, or certainly probably a bigger focus on Manhattan. How do you think about getting your service out to broader communities, and what kind of efforts are you making in that regard?
From the very beginning, so the mission of Capsule is to build a pharmacy that works for everyone, and that's certainly that's part of that is to serve every consumer, and part of that is to serve the broader healthcare system. And I think, kind of particularly during COVID, we've seen a really sort of widening of the aperture of the types of people that use Capsule, and the demographic has always been relatively broad. And as one, Capsule is free for everybody to use, and we accept all types of insurance. So whether that's commercial insurance that you have from your employer, whether that's Medicaid that you have from the government, whether that's Medicare, we serve this breadth of folks. The other thing that we've done from the beginning was to really make the product accessible through a bunch of different doorways. And so if you're really tech savvy and you want to use an iPhone app to use Capsule, like, great. If you want to use it on your desktop computer, like, great. If you want to use it over SMS only, like, great. And if you want to use it on the phone, like, no problem. We have a really nice team of folks that'll, pick up the phone and kind of walk you through how to do that. And so it's always been important for us to be able to serve this kind of wider demographic of folks. I think we've done a couple things specific during COVID. One is in New York with the kind of Department of Homeless Services. The homeless shelters became and are like one of these kind of concentrated epicenters of COVID outbreaks, not unlike prisons and, meatpacking facilities and kind of all these places. And so one is, we've partnered with folks to be able to just make sure people have access to medications. Something we recently launched in Chicago. And one of the things we did in Chicago was, on the south side of Chicago, there is a pharmacy desert. There is real lack of access to pharmacies. And then as part of some of the protests and rioting and sort of social unrest that we saw over the last month, a lot of the pharmacies on the south side of Chicago were closed. And so we ended up partnering with the Chicago Housing Authority, which has 75,000 residents on the south side, to make sure that those folks had consistent access to medications, despite pharmacies being closed. And we launched in Minneapolis, our pharmacies in the epicenter of these things. Every pharmacy in Minneapolis was closed for a week. We were open, serving a wide demographic of people during the time. And so I think the model has let us serve old folks and young folks, wealthier folks and less wealthy folks. And that's always been both the promise of the business and also the promise of the market size, right? Like 70% of American adults go to the pharmacy at least once a month, and they're not all, Manhattan living, iPhone toting, wealthy people.
Yeah, thank you, Eric. Ara, over to you. I mean, how do you think about this same point around just broader access to your products and services and maybe the market at large?
Yeah, it's something we think about all the time. I think it's incredibly easy for anyone to look at us probably from the outside and be like, oh, it's like an expensive wellness product. And, certainly today we're, $49 a month, which, we basically break down to around $1.67 a day today. And that's obviously on subscription. If we were selling it one-off, it would be more expensive. Part of it, it's not dissimilar to some of what, Francois said, which is that, I think, and I think we were talking about this the other day on the prep call, which is, if you look at Tesla, which has this mission to kind of remove our dependency on fossil fuels, they started with a $250,000 sports car, right? And so sometimes, and particularly with us, where we're trying to take like a life science and biotech approach to a category that traditionally has cut many corners, and in the US is currently not regulated the way it is kind of in the EU. Science is also not cheap. And where we started from was coming out with saying like, okay, we need to invest in the model first. What that did though was allow us in creating a very sustainable business off of this first product. And actually the rest of our pipeline looks at many areas where we actually hope, and particularly when we get to areas like infant formula and a food ingredient that we're working on that will be a replacement for something that actually disproportionately affects a lot of populations that because of the way our food system works is incredibly inequitable. We're looking at like either one-to-one with like the cheapest pricing or really unique business models that will make it really accessible. But overall at Seed, from a Seed health perspective, not just Seed, the consumer brand, we've used the consumer business's sustainable revenues from our subscription business to fund and move drugs into the clinic that actually the drugs themselves will be cheaper than the alternatives that are available today, and done it with a kind of efficiency and speed, and potentially will bring drugs to market, will be the cheapest that have ever been made to date. And that impact 50% of women in the world, and in the instances of BV and preterm birth, disproportionately affect Black women by multiples, especially in the US and even in developing world. And so I think, it's very easy to sometimes just look at a singular product and then say, oh, inaccessible. But I think, there is that piece where you have to start, and innovation upfront is not always cheap, but the investment itself and the early adopters and the people who are willing to create the sustainable business model that then allows you to make something that's both more accessible but also potentially has the greatest impact, I think is kind of how we approach it.
And thank you for coming to my webinar.
Well said,
I want to be the only bad guy on the panel. And I think there's an important point too, which is quite known in neuromarketing. There's such a thing, which is that the price plays a big role in the placebo effect of a product. And placebo is a booster of the actual effect of whatever we do. I think it's important for people to really desire your product. It's important for them to believe in it, and the price and the science behind and all the efforts you put, all the studies you put, participate to that. And I think that's part of the pricing too. It's not just, we want to maximize profit, which we do, obviously, that's our responsibility as well. But it's also a matter of putting a price out which makes people believe in what you do. And it's actually true.
I'd also, one last thing I would just add is that all of our education and all of our content, nothing's behind the paywall, and all of our education is free, and we spend a lot of time creating content and education.
I think we're out of time. Thank you all so much. Our Francois, Eric, really, really appreciate it. Very proud of what you guys are doing, and we'll talk soon. Thank you.
Thank you, guys. Have a good day.
Bye.